Hi there, good evening. How is everybody? This is Dr. Sabine here with Canelli, our wonderful health coach. I'm an OBGYN for you, for the ones of you that they don't know me. I'm a classical OBGYN that took a little turn. I'm very, very blessed because I combine both worlds and I operate, I deliver, I do all the bread and butter obstetrics and gynecology, but I am very specialized in holistic gynecology. And that is not some voodoo or anything, but it's just something that we want to really, with all the tools that you can get, if it's acupuncture or if it's homeopathy, if it's functional medicine, there are a lot of elements also from functional medicine that I'm using for many, many years. And what we're interested really are, and in my practice and me and Corneli together and all the courses that we do, is that we really want to help you guys connect the dots so that you feel that there are some answers, that these answers are soundproof and legitimate. They are medically, proven, and for sure, through my long years of experience, I can tell you that I have a lot of proof in my clinical world with all these lovely patients and all these lovely ladies that I've been seeing for so many years. So, you know, so I'm in a way a doctor that is very solid conventionally, but is also very experienced holistically. And what we want is really, we want to address the problem at the root cause. So we don't only want to, you know, treat symptoms with antibiotics or with steroids or with surgeries. We want to really look why this pathology has occurred. Why do you have the symptoms that you have? And we've really put on this catchy title for this little session today is, why does your doctor not tell you? How did we say it, Canelli? How,
Or
why?
why are your symptoms not being addressed by your doctor?
Oh, yeah. So this is something that I really see every day. I really see very many new patients every day. And these are patients that they have come a long way. They have gone through their GP, they have gone to the gynecologist, they have gone to the psychiatrist, they have gone to all the variety that we have in medicine, and they really feel that they have symptoms that nobody takes serious, first of all. They kind of get brushed off, and they're not heard, they're not really taken serious in their complaints. And the wonderful thing with us women is really that we have very good instincts, and we have a feeling when something's wrong with us. We have a feeling when there's something, not working the way it should work. And this is something that we should trust and we should also follow up with, and not be hushed away and say, this is just psychological, or this is something that you have to put up with. I mean, the majority of women that I see from all over the world, either in my office or on Zoom, is really complaining about exactly that. They have, they feel not themselves, they feel exhausted, they feel very much, very much under the weather. They feel that they cannot really focus and concentrate. They have hair loss, they have painful intercourse. I mean, the list is long. And again, everybody says, your blood tests are normal, nothing wrong with you, so go and see the psychiatrist. So this is something that I hear everywhere. A Canadian woman said to me the other day that her doctor that she saw said, you have to suck it up. Oh, can you believe that, Kanali? You have to suck it up. So this was a relatively young woman, I would say maybe 42, with very clear picture of premature ovarian failure. So she went into the menopause earlier, and she was just told to suck it up. So she couldn't sleep, she couldn't concentrate, she would be forgetful, she would be aggressive and tearful at the same time. She would have joint pains, very bad, body aches, and painful intercourse. So no libido, if you're in pain, why would you want to have sex? All of that, which is like a huge blow to for your existence, to your well-being, to your, to your even, wanting to be around feeling that if you have all of this, it's very, very difficult to function. Then you're told to suck it up. I can't believe it, really. I mean, but that is really something that a lot of women are facing. And I really, we wanted with Canelli, we wanted to really look at this a little bit, So I would say we don't want to create this frontier here against other doctors, because obviously everybody works with their best consciousness and their best intentions. That's what I would say is, hopefully a given fact. So I believe that a lot of the ignorance and the non-acknowledging comes really from the fact that there is not much being taught around this whole complex of perimenopause and menopause. So this is something that if I even look back in my medical school, it wasn't even touched. I mean, that was nothing. And also it's really a big of a taboo subject. So nobody really wants to touch this subject of hormone replacement therapy, because there's still this old belief that hormone replacement therapy equals cancer, which has absolutely been, has been eradicated, has been looked at with different studies. It's really not the case anymore. And we've been looking at that for the last 5, 8, 10 years, and we've been giving really treatment very happily with women really finding themselves again. So I think it's this dilemma that, people have not maybe followed up with the newest trends, and, the fear of what was the status quo since 2001, that you cannot give anything because you might cause breast cancer. And also the fact, Canelli, that, what is I always find so super shocking, that the majority of any kind of pharmaceutical research is really carried out on men. And what does that mean? That means that we are actually supposed to take medication that has only been tried on men. And that is something, I mean, you have some statistics there, Canelli, that is really mind-boggling and really shocking, to really think that, our bodies are considered as too complex and as too unreliable because of the cycle, and that we cannot be included in any medical trials. And that means that everything that has been in the market has really been, tried only in men.
I mean, they say, there's a 50% diagnosis around anything cardiovascular for women goes misdiagnosed. So, I mean, just imagine, what that is in terms of impacting women's health. So a woman also whose symptoms around cardiovascular don't always present as they do with men. With men, there's chest pain, or back pain, right? Or even lower back pain, which sometimes also gets misdiagnosed. For women, there's also nausea, and there's, other kind of pains. You could be feeling dizzy, and this isn't the same presenting in men. And we know that, women were not included in medical trials until 1993, right, when that law was actually just changed, right? And that happened, of course, that was implemented in the United States, which is quite shocking. 1993 was like just the other day, really. So, and there's no judgment around that. It's just that women's bodies were never the same at every time of the month. We know that, right? In 28-day cycle, we are very different on day 1 as we are on day 27 or 26. So to put a woman through clinical trials, they couldn't actually judge women according to the same statistics. And so they just found that it was way easier just to test it on men. Men have got the 24-hour circadian rhythm, and they could actually do their clinical trials, which of course has left a humongous gender gap, like a bias in the medical world. And then add to it the patriarchal conditioning for women, right? That we learn to just listen to authority and be good and subservient. And even if that intuition came through and said, but there's something not right, we will listen to masculine authority with a white coat because we've been conditioned of thousands and thousands of years to, so even as women, and sometimes women will say, but I knew there was something wrong, but I didn't speak up, and you hear that in your office all the time. So it's all of these factors.
Yeah, and I think really, I mean, for me, we're all very much familiar with the term of pandemic, but for me, really, the very much longer existing pandemic or epidemic is really the ones of hormonal imbalance for women. So there are like so many pictures to it, and so many faces and dresses that they wear when they are in certain situation. It's really it's quite shocking to see that then these women with a little bit of support, I mean, support of the gut, support of the adrenal glands, the stress management, sleep management, breath work, and the blood works that you just do you can actually supplement women with the hormones that are missing. I mean, it's just so essential, but it's just not gynae only. It's really a very complex factor of all the different symptomatology that really leaps into a women's life. And we're just here to just function, to be in a good mood, to want to do sex, to produce babies, to work, to be a workforce, bring in money, and nobody acknowledges the complexity of our hormonal system that is just, with the lifestyle that we have created in this world, has become so much more frail and vulnerable. And that is something that I think we women, we should all really acknowledge this and have this as our, as our baseline, that we are really that we have the right to be functioning well, and that we have the right to be in a shape that is for us the best and the absolute optimum. And it comes down to really following your instinct and being there for yourself and showing up for yourself. And if you have this symptoms and the symptomatology that you really feel that you're not feeling well, and you're not in the condition that you wanted to be for all this time, then you should ask for it. You should really be in that place that you're demanding your well-being, and not be just hushed off. This is really something that I see so many women that they're crying in my office because they say, the first time I hear somebody taking serious all the symptoms that I have for all these years, and not just laughing about me, or being dismissive about my symptoms. So, and that's really something that I want to encourage very much, that wherever you are and in whatever country you live, if your body tells you that you're not well and you're not feeling yourself, and you really have all the symptoms that concern you, then you need to not stop until you find a healthcare provider that will listen to you. Correct.
Yeah, and we see this often. We see this a lot of the time, but women are saying, but I don't know what to do. So where do I go? Which door do I knock? And I often tell people you can't order fish at a pizzeria, right? If you keep going to the same medical practitioner that had the same kind of education, which had gaps in the education, then you're going to get the same result. You're going to be prescribed a tablet, or a hysterectomy, or go on the pill, which is kind of, these options. And it, it's not about a blame game. It's just kind of like saying, well, if you want fish, then don't go to a pizzeria. That you're going to get pizza there. And then you can't be mad at the pizza person, So we always say, like, we've got to look at, I mean, 20, 30, 40 years ago, people were not told, look at your diet. And think about how the world has progressed now in the last 50 years. I mean, look at our supermarkets today. We've got 300 different kinds of cheeses now. Now, 40 years ago, when you're going to the supermarket, maybe you had 2 different kinds of cheeses available. So we have to become a lot more rigorous. We have to read our labels. We know that food is not being approved by legal entities, right? So we have to be rigorous about what we have to go back to nature, make sure we're eating things from raw source before, pesticides, chemicals, phthalates, and
Yeah, to be really, to be vigilant what you're putting into your mouth, and to be curious. You cannot just, feed yourself with whatever is being offered. You need to really be vigilant. Yeah.
and this whole thing with autoimmune has just progressed. I mean,
A
20
tsunami.
years ago, it was 1 in 400. 1 in 400 had autoimmune. Today, it's, 1 in 6, of which this is 80% women. So, and the thyroid is another area that Dr. Sabine, you can speak about, which is another epidemic in itself.
Absolutely. I mean, the autoimmune disease that is called Hashimoto, because it was a doctor that was called Hashimoto that detected in the first place. It's basically, your own immune system working against your thyroid function. And this is also something that, you might experience symptoms, and you might really feel very lethargic, and you have the thinning of the eyebrows, and you have all of these, symptoms that could potentially appear. But what can we do in order to avoid that? So we're looking at all these horror stories in the world, and we're looking at all these, on the political level, and we also seeing, that there's so much on a health level. But I mean, if you look at these kind of politicians that we have, I think it's just something very, very normal to expect that these people are not exactly out for looking after our health and being interested in, making the optimum choices for the humans that they're reigning. So I think this needs to be taken in your own hands, and it needs to be taken into your own personal initiative, that you can actually, find the healthcare provider that really will give you, a root cause directed answer. I mean, it's like me doing a surgery on a woman with a fibroid. I will not just take out the fibroid. I will change her diet. I will give her supplements to support the liver, that she metabolizes in the right ways, and I will make everything possible that she doesn't get another fibroid. And when women seek medical help, and most of the times they get ignored, then that is definitely not the right pathway that you should take. So especially with the hormones, it's something that is very important, that you actually see the hormones in relations with each other. It's not just about seeing the individual level and then you're told they're normal and they're not normal. If you don't feel well, and even if your blood tests show okay for the, for the test they've done, then it's just not good enough. Then you need to treat based on the symptoms. That's something I've been doing many times. Okay, I use the blood test and the testing, that is available. But if I don't find really the findings on the blood test, doesn't mean that the woman doesn't have the right to be treated, because her clinical symptoms for her individual body are just different. And this is what it's all about. It's personalized medicine. It's personalized medicine that wants to optimize the health and optimize the organ function. And that's the only way that you can really achieve a very good and long health span, not just only a lifespan, because the longer we live, we want to also live healthy. And in that sense, we really need to address the body as a whole, and that's what holistic comes from. So we really look at the gut function. The gut function is something that it's almost shocking how immediate the results are if you stabilize the gut function, if you address a leaky gut, if you treat a SIBO, short intestinal bacterial overgrowth, and if you really balance the microbiome in the patient, and this is very most of the time really the underlying cause for so many autoimmune symptoms and diseases, and so many women that they really, when the microbiome and the gut function is optimized, the majority of the symptoms goes down, and very often with time even disappears. So my experience really is that we need to look at the person and the patient as a whole, and really address all the sides of dysfunction, rather than just giving one tablet for the symptoms, because you've experienced it, I'm sure, many times. You get a urinary tract infection, or you have like recurrent vaginal itching or whatever. You just give treatment, and then a month later you're back to square one. So it really needs root cause treatment rather than just symptoms.
I just had a lady who had a chronic tooth infection. She had to go get tooth removal. And what they did was they removed the tooth the same day they put in the bottom part to replace the tooth. So in this raw wound, right? So she had, started the treatment
Implants.
to put the implant immediately. She had chronic pain, so she was on, I don't know, 6 different courses of antibiotics just to help the pain and and then of course, no surprise, 2 weeks later, she gets this chronic flu infection, right? Because now we've lowered the immune system, we've destroyed the gut flora with all these, antibiotics, and now we're more susceptible to more viruses. And it's kind of, there's no connection of the dots there. Like there's no awareness that that's what's happening. It's still overrode. Well, I've got this is the way to go, the doctor gave it to me, and off we go. The other thing I was reading the other day was the connection between, we've new science has told us now with Alzheimer's, it's not just about the amyloid plaques anymore, but it's actually, has the woman gone through any H. pylori, what's happening with the gut, with the leaky gut, if she's had any gut dysbiosis, chronic gut dysbiosis, any periodontitis,
Periodontal.
that's also going, but that's a mirror then of what's happening in the salivary, in the gut function of the salivary glands. The gut starts in the mouth, right, in the salivary. And so, we're understanding a little bit this. So it is important to get, doctors to keep updating their knowledge.
I mean, especially for the Alzheimer, I mean, there's quite a lot of evidence now that if you have a healthy, you know, um, mouth and teeth situation, that you have much lower risk of developing dementia or even Alzheimer. So it all points in the right direction. We all know that, but of course, what matters is time. And if we have of course, it's much easier to prescribe antibiotics, and 5 minutes later, the patient has left your consultation room. It's much more time consuming to take a detailed history, to look into habits, to go through the diet, and to really make sure that patients, have the adequate diet, educate them, because don't think it's not easy. Not many people, are open-minded and say, okay, that if you tell me I should change my diet, then I will get rid of my, vaginal discharge. They say, is she crazy? What is she suggesting? But the people that they do it, they actually cannot believe that that is, how good the outcome is, because they really don't have anymore all these very nagging symptoms. So I think that's why we are also here tonight and again, and we spend so much time of our personal time with educating our community, because if you, like, how do you say, you educate one woman and the whole village n- will know and will implement, and that's very much true. So there is a lot of gap of education that is should slowly, and I think there are some initiatives that they're actually talking to the children in school about diet. And they're, I don't know how it is with your children. Do they get educated on the diet and what to do and what not to do, or not yet?
I mean, the textbooks are so old, outdated. We're still dealing with a very old model, which that model came about after post Second World War, when there was a lot of storage of animal-based products, the dairy products. There was a surplus happening, and so the government decided to do a funding campaign in order to push out, and they came out with that campaign, which was 2 glasses of milk a day. It's kind of like the apple a day keeps the doctor away. That's a lot more healthy. But all the propaganda that came about with cows' dairy, cows' milk, that keeps you strong and builds your bones, etc., etc. And there still is that propaganda today. So a lot of women, we find that when they get diagnosed with a little bit of osteoporosis, they're chugging down the milk, not realizing that milk is a very inflammatory. It'll raise your inflammation markers in the body, because it's actually quite difficult to metabolize. And also the problem today is, what are the cows being fed? They're eating grass, which is full of glyphosate, which we know is actually raising the bad estrogens in the female body. So now we have all these women that are chronically, not only chronically inflamed, but they're also struggling to metabolize and get rid of, the bad estrogens of the body. So this glyphosate is going into the body, and the body's trying to work out, what do I do with you? I don't know. I didn't get, the manual on how to metabolize you. And so the only other thing is, those estrogens, where they're going to go, they need to go and attach themselves to fat cells. And we know that a lot of fat cells are sitting in the breast. And here we go. Breast cancer has been on the rise in the last 20 years at extraordinary. 20, 30 years ago, you maybe might have heard somebody with breast cancer. Now we all know 3 or 4 or 5 people in our circles, which is an ongoing. It's not such a, bad word that we don't say anymore. 20 years
It's
ago, nobody used to say the word.
not to attract the bad energy. Yeah. Now it's really the new grippy, the new cold, really, is the breast cancer. Anyway, but yeah, but I think coming back to the concept of, if your body shows you symptoms, take them serious. And if you're not acknowledged by whoever looks after you, find somebody else. That's really what I would say. It's really very important that you follow your instincts and follow your complaints, and stand up for them. Don't be shy of them. There's nothing wrong with you if you have such and such and such symptoms. You have them, so you might as well want to address them. And I think that is what our little talk is about today, that we really want to encourage you to really take your body's language serious. And if your body's language comes with complaints and symptoms and all of that, that means that you really need to do something about it. And if you don't have somebody that listens to you, then find somebody else, or in the worst case scenario, make an appointment with me or with Canelli. It's very simple, and we can then direct you, maybe wherever you live. So that is very important. So ladies, please be encouraged. Have your have your instincts alert and look out for yourself, because nobody else is going to do it. And I think because there's so much burden on our shoulders with everything that, the way society has become, that we owe it to ourselves to feel well, to have energy, to be able to concentrate, to focus, not to be really in brain fog and have these symptoms hurt. So don't think you're crazy, don't think you're stupid. It's really the honest truth that our body speaks. So, and if you listen to it, you're to be congratulated and not to be hushed away. That's what I would like to say to you. Thank you very much for listening, and we'll be back soon. Bye bye, everybody. Good night.